EzzyCare is a medical app that connects healthcare seekers to the nearest healthcare providers to them. It connects people for video consultations, physical consultations, lab tests, and any other health services that are offered normally. So essentially, EzzyCare is just like having the hospital in your hand. So we have thousands of doctors on this platform. We have nurses, we have lab scientists, we have pharmacists, we have physiotherapists, and different categories of healthcare providers.
EzzyCare Community Initiative, it's a project which the company EzzyCare has brought in to help the rural people.
We noticed that there's a particular challenge that we have in developing countries like Nigeria, and we thought about how we can reach people in the rural areas using the same EzzyCare app. That is when we came about the EzzyCare Community Initiative, also the ECI. We noticed that people have challenges getting access to qualified healthcare providers. Many people have that challenge. In the rural areas, it's a very, very big challenge.
This ECI has bring so much impact on the rural settings that we have started working with. We have establishment here at the NKST Hospital Car, and we have other places at Ayilamo, which is local government, and then Vandikia at the township area. It's very seamless when it comes to EzzyCare, because as a patient or probably a care seeker walk into our facility where we normally mine, first of all, you meet the booking agents. Booking agents are those people that possibly, in a layman language, you may call them customer service. And once you get to the customer service person, definitely you will get more information about what you really want. And by coming to the booking agent, they guide you on the process. And this process is a seamless process. You get to them, they'll book their most available doctor that is willing to accept you at any point in time. Once the doctor is booked by the booking agent, the money is paid to the cashier. Once you are done, one of the agents will lead you, or possibly any attendant that is available at any point in time, will lead you to the doctor where you will meet the doctor.
From the inception and the beginning of the partnership between the hospital, the NKST Hospital Car, and the EzzyCare, it has actually been so a smooth going, and it has actually helped the hospital so much in terms of the inflow of patients. And I can say I've been in this hospital getting to 2 years, and I've seen how much the presence of how much positive impact that the ECI have given to the growth of this hospital.
If you get to facilities around here, the shift is a 3 times shift, morning, afternoon and evening. But then the evening is only for nurses. Doctors close by 8. Other admin staffs close by 8. But here at EZI, we run a 24 hours shift. We don't close. Booking agents sleep here. pharmacy technicians sleep here, the doctor is always around here. So there was a case last week where a lady was rushed in here at odd hours around 2 a.m. But because of our availability here, we were able to save the whole situation. Immediately we booked the doctor because the doctor already knows that we run a 24 hours duty here. So he's already aware. Once he hears an alarm of any booking, he starts coming because he stays very close to the hospital here. So that particular day, the patient came around 2 a.m. Immediately we booked. I was surprised. I now heard his horn entering the hospital. That's how we saved the whole situation.
Our aim at the pharmacy units is to provide an holistic health care, a good relationship between the healthcare providers and our patients coming to the hospital. The benefits of EzzyCare ECI pharmacy to the patients is the patient has been able to have access to all their medications being prescribed by the healthcare provider, the doctors, and 90% or 95% of all medications needed in the facility are all available at the pharmacy here. And depending on the diagnosis, even surgeries, every aspect of our consultation, the gynae and the cardio, all the medications needed for the patient is available here in the pharmacy. And it's also to the community. Looking around, there is no really pharmacy, the standard one within this community. So aside from our inpatients, we have some other clients that comes outside to get their medication in the hospital. And one of the benefits to the community and the facility is we run 24 hours. So anytime there is always someone on ground to attend to you.
ECI, quality is our watchword. The word will ensure that patients are given the quality treatment that is rare in other health facilities. Now, before the coming of ECI to this facility, the number of patients that were coming into the hospital, before we came, it had declined already. In fact, some people have thought there was nothing serious happening to the hospital again. But since the coming of EzzyCare, people have been coming. In fact, we have people coming into the hospital as far as from Cross River State and from other states. It's hardly you come into the hospital and there is no patient. Before now, hardly you get like 5 number of patients on admission. But I can tell you that most of the times, like currently, we have more than 7 that are on admission. You know, so there's great improvements in the hospital, and on the aspect of the nurses, the number of nurses also have been increased. You know, they have added more to ensure that patients are given the treatment, you know, the nursing care they are supposed to receive.
This is one of our ECI centers at Ayilamo. At most of these our various ECI centers, because of the remote areas, we normally prefer to have video consultations. And this video consultation, a doctor is being booked by the booking agent, and once it's fully booked, the doctor communicates with the patient via video consultation.
So I've been having constant chest pain and my spinal cord, especially mornings when I wake up.
After the video consultation, the processes of a doctor seeing a patient on a normal physical consultation takes place. The doctor now, possibly if there are certain symptoms that a doctor can go ahead and have a prescription, a doctor goes ahead to give a prescription to a patient. If all these things are done, if it's what requires a patient to have a bed rest, the patient is now moved to the center, the community health center that EzzyCare is collaborating with, and then there the person is referred to the ward, which with the little bed space they have, it all depends on the number of hours that the patient will be allowed to stay there before the patient leaves. For the drugs, the same processes that at the normal physical consultation when a doctor had with a patient, EzzyCare provides at these remote areas to the pharmacy end, and you go there. Once everything is done, you go there, get your drugs as when you are supposed to get.
Before the arrival of this EzzyCare program, we are facing a lot of challenges because most of the cases were being taken to Makurdi or any of the higher hospitals. As this building established here, most of the cases are being treated here, which are being not taken even in Car teaching Makurdi Teaching Hospital and most of the hospitals around the state. Most of the cases are being cured here. We, the community Tombo, as a large ward in Logo local government, we are very, very happy.
ECI is bringing healthcare to the rural people, to the grassroots, to ensure that whatever you are getting at the general hospitals, federal medical centers, is taken down to the grassroots.
We say these doctors who may not be able to go to the rural areas, but on EzzyCare, they are ready to go to the rural areas. And how do they go to the rural areas? They can have video consultations, and then they can pick a day in a week that they go to visit the communities. Not just that, we made it in a way that they will subsidize their prices significantly. So EzzyCare doctors, a doctor that may charge 30,000, 20,000 naira for consultation fee, when they come to the EzzyCare Community Initiative, that's the ECI, we had an agreement that they would charge as low as 2,000 naira, 3,000 naira for their consultation. So the healthcare providers are also willing to offer their own humanitarian services to the communities on the ECI platform. So in this way, community members can be able to afford the services, where the community loads that wallet, they pay money into that common wallet using a particular phone, and with that phone, anybody who is sick just comes there, pays money into the wallet, and is able to use and book the doctor. It's as straightforward as that. And so people who would probably not be able to travel hundreds of kilometers to see a doctor, they just sit in their village and they can book a video consultation with a doctor, or they can have the doctor come to visit them from time to time. And when the doctor is able to diagnose the problem, they can now refer to a place that they need, they can get attention. An example we have is the ECI Center in Ayilamo, where it's a border town and has issues of insecurity. And you can understand this ward is like the biggest ward in the whole local government, but there's no medical doctor presence anywhere. You have thousands and thousands of people. But with the ECI, these people can be able to access a doctor. So when people have problems, we partner with the primary healthcare center. What they do is that they come to the ECI center, and at the ECI center, once they load the wallet with the consultation fee, they can talk to the doctor, and the doctor can prescribe drugs for them. The doctor can tell them what they need to get. And we also have at the lab that they can do their lab tests, and then of course they can also get their medication. So essentially, EzzyCare Community Initiative is something that will help the developing world, and people can be able to access healthcare from anywhere. So we think it's something that will change the healthcare system in the developing world. The healthcare providers also have something that they do that they make extra change. So the issue of traveling, leaving the country, migrating to other parts of the world will also reduce, because they can see that instead of just making their salary at the end of the month, they use their spare time to do video consultations, to see many people, and they are making money through that. We call on partners who may want to help their communities. Individuals can do it. So instead of the communities loading their wallet, you can help to load their wallet, and that's subsidized care. So we say instead of giving people money during Christmas or giving people money to marry second or third wives, just load their wallet. In that way, when anybody is sick, they can go and access health care using the EzzyCare platform. And the government can also replicate this thing all across the country. And internationally, it can also be applied. Countries in the developing world, we are willing to partner with them to set up ECI centers, because EzzyCare is anywhere. You can download EzzyCare from anywhere in the world.